You're listening to the Nourished Child Podcast, episode number 33, Modern Management of Food Allergies in Children with Marion Groetch. I'm Jill Castle, registered dietitian, child nutrition expert, and the host of the Nourished Child Podcast, a show about childhood nutrition, feeding kids, and dealing with the ups and downs of raising healthy kids inside and out. Today we are talking about food allergies in children. A lot has been happening in the area of food allergies, from new research findings which have changed the way we introduce foods to our youngest children, to groundbreaking research in the treatment of food allergy. I asked Marion Groetch, a food allergy expert located in the New York City area, to hop on the show today and give us all the latest and greatest updates and strategies for managing food allergies in children. You can find today's show notes with all the links I mentioned over at jillcastle.com/033. That's 033 for episode number 33.
Welcome to the Nourished Child Podcast, a show about childhood nutrition, feeding kids, and dealing with the ups and downs of growing a healthy child. Here's your host, registered dietitian and childhood nutrition expert, Jill Castle.
Hey there. How are you today? Thanks for joining me on the Nourished Child Podcast. You're in for a real treat. Personally, I've wanted to have Marion Groetch on the show since I met her in person last October. I've known her, or of her rather, for years, but I had never met her face to face. And I had the opportunity to do so at a meeting that we were both mutually attending, and I'm super glad I got to meet her. She has been plowing ahead in the field of food allergies for decades, and I personally consider her my go-to guru on all things food allergies. Not only does she do patient care, she is also involved in many of the research position papers that come out on the topic of food allergies, and even esophageal esophagitis and FPIES. She's involved in all of that stuff. So as a mom with a child who has food allergies, and as a pediatric dietitian that cares for children with food allergies, and someone who also writes about food allergies for the public, I consider myself to be pretty up to speed with the latest nutrition information about food allergies. But I still like to get validation and assurance that my knowledge is up to par, and I wanted to showcase Marion for you all so that you'd hear it from one of the best sources you could hear it from. So there's no one better to do all of this than Marion Groetch. But before I introduce her, I want to tell you about what's going on with me. So Food Parenting Pro, that online workshop for nutrition professionals, is well underway. We have over 35 students enrolled. We've gone through 3 out of the 4 live classes, and the course wraps up at the end of June. But if you're a nutrition professional or a pediatrician or a healthcare professional and you want to learn about food parenting, it is not too late to get in on this offering. Food Parenting Pro lives on my website on a special password-protected platform where I store all the video recordings, the scientific references, and the supportive PDF handouts. So if you're interested in participating in this course, you'll be a self-study learner. You can do this by joining at any time this year, and you can still get the CEUs, which there are 8 of them that go with this program, up through June of 2018. So once you join, you'll have access to everything on the platform for the lifetime of the course. You can go to jillcastle.com/nutrition prep school for details about the workshop and the link to register. Parents, if you are looking for some of my articles about food allergies, I will include links in the show notes, as I have written several. Plus, I used to be the food allergies expert over at about.com, now called Very Well. There's lots of information there too, so you can find all that in the show notes at my website, www.jillcastle.com/033 for episode 33. Okay, let's talk about Marion and get this show rolling. So Marion Groetch is the Director of Nutrition Services at the Jaffe Food Allergy Institute at the Icahn School of Medicine at Mount Sinai in New York City. Marion is a frequent invited lecturer both nationally and internationally on diverse topics related to the nutritional management of food allergies and has written 9 textbook chapters and more than 20 peer-reviewed publications with over 200 citations, including authorship on 2 American Academy of Allergy, Asthma, and Immunology consensus guidelines in 2017. We talk about that a little bit in the show, actually. Marion earned the 2015 AAAAI Allied Health Professional Recognition Award for her service to the allergy, immunology, allied health community as a leader, mentor, and educator. In addition to her work in food allergies at the Icahn School of Medicine at Mount Sinai, Marion is lecturer and course director for the graduate level course, Essentials of Nutrition Counseling and Medical Nutrition Management, at the Institute of Human Nutrition at Columbia University, College of Physicians and Surgeons. So, she is a very accomplished registered dietitian. And let us now just jump right in. Here's Marion. Hi, Marion. Welcome to the Nourished Child podcast.
Thanks so much, Jill. Thanks for having me.
I'm so glad you're free to be on the show today. I know we've been going back and forth trying to coordinate our timing, and with the spring and all the meetings, I know you do a lot of presentations. It's you're a hard lady to pin down.
Well, it's an honor to be here, so thanks for inviting me.
Oh, you're so welcome. So today we're going to talk about food allergies in children. You are, in my mind anyways, the expert and guru on this topic, so I'm thrilled to have you here, and I'm so excited that my audience gets to benefit from your expertise. But before we get started with sort of our interview questions, I thought it might be fun to just hear about your journey into nutrition and how you got started in the specialty of food allergies.
So food allergies is actually sort of an interesting way I got involved in food allergies. It was almost accidental. So I had finished my master's degree, and I was working for a number of years, probably about 5 years, before my husband took a position in Germany. Actually, we lived in Germany for 3 years. So I left work and we went to Germany, and I didn't have a work visa there, so I didn't work while I was there, which was really nice actually because I had small children, so it was sort of fun to be forced to stay at home. And I enjoyed that time that I had with them. But when I came back, I felt a little bit rusty. I wasn't sure where I was going to go. And I ended up doing a university-affiliated program that it was, I think, funded by the Maternal Health Bureau on neurodevelopmental disabilities. So I did a fellowship in nutrition on neurodevelopmental disabilities. And when I graduated from my fellowship, I started working on a feeding team. And I worked on a feeding team for 7 years thereafter. And it was really fun. I enjoyed the work. I covered all of Westchester County, but I was alone. I had no dietitian colleagues. And I felt in order for me to really learn, I needed to have sort of a home, where I had colleagues that I could learn from. So this position came up at Mount Sinai at the Jaffe Food Allergy Institute only because they were looking for somebody to run the feeding clinic that they were going to develop in association with the food allergy clinic. And so really interesting, right? So I was it, and we were. I got involved in the very beginning. We were creating the designs for this feeding clinic that was going to be built alongside of our food allergy clinic. But then it took 2 years to build. And in the meantime, I started getting involved in the food allergy aspect of pediatric nutrition and managing children with food allergies. And by the time we were really ready to start the feeding clinic, I realized that a food allergy clinic is just as big as a feeding clinic, and we really couldn't do them both well. So, the feeding clinic actually became our challenge clinic. So it's nice because we have sort of a way for the nurses to actually be able to view a number of different rooms from their vantage point. And it worked out well, but so it was really by accident that I ended up in food allergies, and I couldn't have landed in a better place. I have really wonderful colleagues. I've learned so much from them. And, I hope that they've learned about nutrition from me and the importance of nutrition in food allergies.
Oh, I'm sure they have. I'm sure, no doubt about that. How long have you been doing food allergies then? So what year was that when you really got started into it?
That was 2005. So I've been here for 12 years, yeah.
Wow, okay. And so what is a day in the life of Marion Groetch like at work?
So every day can be a little bit different. My position is divided into sort of different areas. I do direct patient care in our outpatient clinic. So we see patients just like in a normal private practice. So I see patients for basic medical nutrition therapy. And I think it's really important for families with food allergies, that there are nutritional implications, specifically gross implications when children are avoiding major allergens like milk and egg and multiple foods. But then I also am involved in research. And in research, I'm involved in developing protocols for studies, but also counseling patients who are enrolled in clinical research trials. And then education. So I have 3 separate areas, and I have some protected time for education and some protected time for research, and then some dedicated time for patient care. And in education, I'm involved there is an organization called the American Academy of Allergy, Asthma, and Immunology, and I serve on many of the committees there, including the Adverse Reactions to Foods Committee and the Education Committee. So we do a lot of publications through these sort of collaborations, and of course through just our division, we do a lot of research publications.
Mm-hmm, mm-hmm. Wow, it's a very big job, it sounds like, but it sounds also like you have a lot of different angles and avenues to really challenge you and keep you stimulated and interested and on the cutting edge.
Absolutely. I love it. I love every part of that job, but I don't think I would want to do any one part of that all the time.
Right.
So it's nice to have diversity.
Yes, I can completely empathize with that notion. That's why I do so many different things in my own work, right? Because doing the same thing every day gets a little boring for me.
Yeah.
So that's what's so great. Now, one of the things I'd like to ask my guests is to reflect back on either their own childhood upbringing and how it has influenced their own eating, their parenting, or their personal perspective on nutrition, or if not your own childhood, what was raising your children like, or raising your children to date like, and how has that perhaps influenced your practice as a pediatric dietitian?
Wow, that's a lot to think about.
It's a big question.
Well, I would say growing up, I think a big influence on my life and what really got me interested in nutrition was my father's health. So my father had diabetes, and he had his first stroke at 52 years of age. And, at the time, diabetes was managed very differently than it is now. So at the time, I don't know if maybe you're not old enough to remember, I don't know. But for me, it was strict avoidance of all sugar. So we had to every label. But my father was one of these people who really this was a wake-up call for him when he had that stroke. And he was overweight, he was probably obese, and he had just lost all the weight, kept it off for the rest of his life, and he just actually became more focused on nutrition. So in our home, nutrition was very important.
Mm-hmm. Yeah.
In terms of how that translated to my own children, I think at that point it didn't really have much to do with my upbringing, but I was actually very influenced by Ellen Satter's work. So I wanted to feed in a very healthy way. So my kids were, they were fed the way I hope, our guidelines are for responsive feeding.
Mm-hmm.
I think I hope I did that. But but it was funny for me because I had 2 children. One who was a real adventurous eater. He could not wait for the next meal, and if there was a surprise food in that meal and it was something brand new, it was even better. And then I had a daughter who was a very reticent eater. If she had to try something new, or not that she had to, but if she was going to try something new, she might take a little bite out of the corner, and the next time she might eat another bite. But it would take her a long time before she was able to eat a full serving of a new food. She had to really take the time to get to know something.
Mm-hmm.
So it was, I think, these two kids really helped me in my practice because I was able to see that not every child is going to be adventurous and not every child was going to be reticent. And you have to the parent is the expert about the child they have and how we could help that child learn to eat and enjoy a variety of foods.
Yeah, I agree. I often will say, I went through a whole program of learning about pediatric nutrition and becoming the quote-unquote expert in pediatric nutrition, but it wasn't until I was a full-time stay-at-home mom for 9 years that really educated me on how to feed children. Yes. I mean, and you're right. Every child has such a different temperament and personality and way that they approach food and eating, and oftentimes that's linked to how they approach life in general, new situations. So you're right. The parent is the expert, and the better you know your children, the better I think you can feed your children. So I totally agree with that. Yeah. So
I agree.
Go ahead. I'm sorry.
Well, the other thing I was going to say about my upbringing was that I came from a big family. There were 5 children, and at the time, there were no microwaves, there was no convenience foods, and my mother had to cook every meal, even if it was leftover. It had to go in a pot on the stove or in the oven. And so when you feed a big family like that, you're making one meal. You're not short order cooking for anybody.
Right.
So we all learned to just eat everything that was given us, and as a result, I think that's been good for our whole family. We all love to eat. We all love to cook, and sometimes I think the way our food systems have moved to being so much more convenient that it's easy for a parent, even if they had 5 children, to make 5 different meals, I think that we've done a disservice.
And it's made it harder in a lot of ways. Not easier.
Yeah.
Convenient today, but harder for tomorrow.
That's true. Very good.
So, okay, let's dig into food allergies. And just for the audience, I'm sure some parents out there have children with food allergies, but there probably are other parents that don't. So if you can sort of give us a background on how a food allergy develops and what's involved in that process.
So that's a good question. I don't think that certainly what I could say about a food allergy is that it is an abnormal response by the immune system, and it occurs reproducibly on exposure to a given food, and that's really the definition of food allergy. Why that abnormal response occurs is not necessarily known 100%. There are a number of theories. I'm sure you've heard of the hygiene hypothesis, where people feel like we're too clean, and the immune system is sort of just looking for things to do. And a typical allergy is caused by or the immune response is immunoglobulin E, or IgE. And IgE used to actually fight things like worms and parasites, which we don't see a lot in our culture. So it could be that it's just, easily triggered by other things that are typically safe, but for some reason it's triggered. So I can't really say much more about that. There are other types of food allergies that are non-IgE mediated, and we have even less of an idea as to why those are occurring. But we do know it's occurring, and it's occurring at a very high rate. So when you say, that some of your listeners will actually have food allergies, well, 8% of the population of children in the U.S. have food allergies. So I think it's probably likely that you have some listeners with food allergies.
Sure. My youngest child, my only boy, he has food allergies, and that was quite a surprise because, by the time number 4 came around, I had the whole feeding, introduction of solids, that whole system down pat, and he surprised us all. Yeah.
Yeah.
So 8%, and when you say 8%, I know some children have a single food allergen or a single food allergy, and many more actually, or I don't know, many more or not many more, have multiple food allergies. What's sort of the difference, and what kind of numbers are we looking at?
I don't think I know those numbers off the top of my head, but I'm coming from maybe a skewed perspective because I work in a tertiary care center, meaning that, we probably see the worst of the worst, and I rarely see a patient with just one food allergy, but I would imagine that more people will be allergic to just one food. But I could be wrong about that. But we certainly see a lot of multiple food allergies, especially in children.
Especially in children, yeah. So when we say multiple, we're talking about eggs, milk, and wheat, for example. So more than one.
Yep.
Yeah. Okay.
Or, milk or soy or peanuts. Even if you say peanut and tree nuts, that's more than one, right?
Right.
So it's not just nuts. It's peanuts and multiple types of tree nuts. So, yeah.
Yeah.
People are living with a lot of different types of food allergies.
Yeah. And so, in general, are the rates of food allergies rising, declining, or holding pretty steady?
So, according to the National Center for Health Statistics, the rates of food allergies are rising. There are studies that were done actually at Mount Sinai. Scott Zischer did studies looking at the rates of peanut allergies, which actually almost doubled in a period of maybe 2000 to 2010. So, we are seeing food allergies rise. And the reason for that, we're not quite sure. But, I think we're going to find that it's really multifactorial. We have, they think that maybe things like cesarean section and lack of breastfeeding might be related, but even children with atopic dermatitis are at much higher risk of developing food allergies. Delaying introduction of foods might have been more harmful than beneficial, and we're just finding that out now. And, for many years we recommended delaying introduction of those foods that are highly allergenic. We have more natural topical products, lotions that have food allergens in them, and that's probably not a good idea. There's so many things that we can think about that might be contributing to the rise of food allergies, but I think the good news is that we have better means for prevention of food allergies, and hopefully we're moving toward treatment of food allergies as well. So there's a lot of hope in the world of food allergies now.
And just to encapture what the most common food allergies in kids are.
Well, milk is the most common allergen in this country, but it's actually pretty country dependent. So, for instance, in Australia, egg is the more common allergen. Across the world, in many countries, we see peanut allergy as being very common, but in Israel, it's very uncommon. So, it depends, but we see milk allergy is probably the more common one in the very young children, because it arises in early childhood, in early infancy. And sometimes we don't see peanut allergy until a little later because we're not usually giving peanut to 2-month-olds.
Right. And then, we often hear the top 8 allergens, and some of those tend to be lifelong. And again, I want to just set this sort of foundation for the listeners.
Sure.
Some allergens are lifelong, some allergens children grow out of. Can you help differentiate what those would be, and how would a parent really go about assessing whether their child has outgrown their food allergy or not?
That's a good question. So the major allergens are milk, egg, wheat, soy, peanut, tree nuts, fish, and shellfish. And these are what we call the common allergens in the U.S. And because they're common allergens, the FDA requires that these foods are fully disclosed on product labels. So, we know that we can find these, for the most part, on product labels. The ones that tend to be outgrown are milk and egg and wheat and soy. So the vast majority of children will outgrow milk and egg allergies, about 80%. Peanuts, much less likely, but it's still possible. So, about 20% of children will outgrow a peanut allergy. And then, the fish and shellfish, probably even less.
And what about tree nuts? That's my son.
Tree nuts is at about 15%.
Okay.
Yeah, so there's hope.
Yeah.
And how does a parent know? I think it's important that if you have a child with food allergies, that you're seeing a good board-certified allergist that has experience in managing food allergies. So remember I said earlier that these allergies are related to IgE, and they can actually measure IgE levels in the blood. And as they see those numbers come down, that will give them a better indication that the child might be outgrowing the allergy. And as soon as, and every food is different, the level is different for every food, but as soon as the IgE level hits a certain number, the physician might say, well, your child might have a 50-50 chance of passing, not being allergic anymore. Would you like to do a physician-supervised oral food challenge? And that's the best way. Now, sometimes a parent might find out that their child is no longer allergic because they accidentally eat something that they shouldn't have, and they find out they've had no reaction. That's a food challenge. So if they've eaten a full serving and they haven't reacted, that's a good sign they're no longer allergic. So, but it's really good, I think, to be followed by, an allergist who really has experience in food allergy.
That's great advice. One thing that I've noticed with my own son, and he's had a tree nut allergy since he was 2, but now he's a teenager, and I remember distinctly about a year ago, maybe even less than that, he was like almost obsessed with wanting to try tree nuts, really feeling like he was ready and he wanted to do this. Yeah, but it really scared me at the same time. As a parent, I was like, he wanted to do it here in the home. And I was like, no. That bold, I'm a teenager and I think I've got this and I've had no reaction for several years. I should try this. And that really freaked me out. I was like, the teenagers, this must not be uncommon to, as a teenager or even as a child, even as a family, to get sort of emboldened by the fact that there's been no reaction for a long time. And even for a family to become, somewhat complacent. And in full transparency, there have been times where I have forgotten to bring the EpiPen on a weekend trip or something like that. And it's, not intentional, but, life is busy and those things happen. But it occurred to me, as a dietitian, obviously, that, boy, I'm sure other parents are dealing with this too as their kids get older, that desire to eat what everybody else is eating and go ahead and try it on their own.
And not be different. You bring up a really good point, because teenagers are actually sort of a risky group when it comes to food allergies, because they are more impulsive and they are more likely to leave the home without their EpiPen. And, I think that it's an area, it's an age group that we really have to concentrate on and educate them about. And sometimes we have kids that come in and do a food challenge, and the parents are really happy, even if they've reacted, because then the child sees, oh, yes, I am allergic. But it also makes them feel a little bit more confident because they've seen how they were treated and how they can reverse the reaction by using epinephrine. And everybody feels a little bit more empowered.
That's great advice. That's motivating from a parent standpoint, I think, and also for the child. So let's switch gears a little bit and talk about some of the current information that's coming out about the prevention of food allergies, specifically peanut allergy. There's been a lot of talk and some new research coming out about that. But what would you say, or how would you say that this latest research has changed the general philosophy about introduction of allergens early?
Well, it's really sort of turned it on its head in many ways. When I first started here, it was 2005, and the American Academy of Pediatrics had made specific guidelines for introduction of highly allergenic foods. And their recommendations in 2000 were to not introduce eggs until 2 years of age, and no peanuts, tree nuts, fish, or shellfish until 3 years of age. Now, when I started in 2005, there was already some emerging evidence that was indicating that maybe this wasn't a good idea, but it wasn't until 2008 that the American Academy of Pediatrics actually advised that there was no convincing evidence for delaying the introduction of these highly allergenic foods after 4 to 6 months of age. So there were no recommendations to delay anything. You could introduce any allergenic food after 4 to 6 months of age. But there was no recommendation specifically to introduce those foods. And that's how things have changed now. So now the recommendations, and these are based on, and I think maybe we should talk a little bit about those studies, but the recommendations are to introduce peanut early, especially for children who are at risk of peanut allergy.
And when you say early, you mean?
4 to 6. It depends on their risk. So for children who are at greater risk, meaning that they already have a eczema, or they already have egg allergy, for instance, then it should be introduced between 4 and 6 months of age.
And that's
very early introduction.
Yeah, and that's, when we look at, this is where people get confused, and I find that I'm sort of navigating this a lot on my blog and with on my pages on Facebook, is that the recommendation to start solids is 6 months, and then now we hear early introduction between 4 and 6 months. And I've done the research on starting solids, and again, it's that sort of that gray area where the general public information recommendation is 6 months for the general public. But if you look at the research, the digestive system, the developmental readiness, and those sort of fine-tuned details can be indicating that a child is ready between 4 and 6 months, that it's safe after 4 months, right?
Yeah.
And that's where sort of we start to split hairs a little bit, but sometimes that can be so confusing for the public.
It's very confusing, and it's actually also a little controversial because, the World Health Organization says exclusive breastfeeding for 6 months of age. But I have to say the American Academy of Pediatrics Committee on Nutrition supports introduction of complementary foods between 4 and 6 months of age, when safe and nutritious complementary foods are available. And when we look at the European organizations, the British organizations, the Australian consensus statements, they all say when the infant is ready at around 6 months of age, but not before 4 months of age, start to introduce various solid foods. So I think that 4 to 6 months of age is appropriate, but it really depends on the developmental readiness of that child. And I'm sure that you've talked about developmental readiness before in your podcast, but certainly you want to see a child who is ready to eat before. They need to actually be able to sit with some support, but that truncal stability is actually very important so that they can hold their head up while they're eating. That early gag and protrusion reflex have to have diminished at that point. And we actually recommend for those children who are at highest risk only to introduce peanut between 4 and 6 months of age after they've already been introduced to, 1 or 2 other foods. And the reason for that is that we want to know that they're developmentally ready. Because when you're introducing peanut, and what if they spit it out or they gag or they vomit because they're just not ready developmentally to feed, we don't want that to be mixed up with an allergic reaction.
Right.
We don't want parents or even healthcare providers to think, oh, the child vomited, now I don't know, is it an allergic reaction or is it because they're really just not ready to eat?
Right. That makes a lot of sense. And I think for a lot of consumers, when they hear that it is safe between 4 and 6 months of age, if that baby is ready, that's a relief. I mean, even myself, I had children who didn't start solids until 6 months, but I also had a couple of babies that started around 4.5, 5 months. They were ready. And so people shouldn't feel guilty if, they introduced solids at 4.5 months and they're not waiting till 6 months. That should not produce guilt if your baby was ready.
I agree. Now, one thing I would say about that earliest introduction, these are really for children who have severe eczema and or egg allergy. And the guidelines strongly suggest considering evaluation you could actually even be evaluated by your general practitioner or your pediatrician by either a serum IgE, so that they're looking at the IgE level in the blood, or they can do a skin prick test on the baby to make sure that they're not already sensitized to peanut, because that can happen. The child could already be allergic even if they've never had it. And depending on how sensitized they are, the physician will decide whether they should do an oral food challenge in the office under observation, or whether they should strictly avoid it because they think that they might actually be allergic.
Okay, so when we break this down then in terms of, I've got a parent out there with a baby who's 5 months old, and they've got wind of this new information about preventing peanut allergy. What do you tell that mom who's getting ready to start solids? How can she expose her baby to peanuts in a safe way?
Okay. So taking this hypothetical mom, it would depend, again, whether they had any signs of allergy already. So if they had severe eczema or egg allergy, the first thing they would do is go to their physician. And actually with any of these patients, I would say, have your physician guide you. Go to the physician and be tested, and let the physician guide how they will introduce the peanut. Sometimes they want to do a challenge in the office. Sometimes they'll say, it doesn't look like there's any chance that he's going to be allergic. You can go ahead and try it at home. If they have mild eczema or, just like moderate eczema, then we would say you would introduce around 6 months of age after other solid foods have been introduced. And then for kids with no eczema, no food allergy, again, the guidelines say, at an age-appropriate time in accordance with family or cultural practices. Again, I think that the bottom line is you want to introduce it early and feed it regularly. Now, once you introduce, there are some really nice free guidelines that can be downloaded from the NIH, and I have to see if I can find them. I'm sitting here in front of I might not have it right in front of me.
I can. But, we can connect though afterwards. Yeah, and I can post it in the show.
So there's a food allergy guidelines portal on the NIAID site, the National Institute of Allergy and Infectious Disease Guidelines site, and they're introductions for home feeding of peanut protein for infants at low risk of allergy. So basically what it tells you is how to prepare a challenge. So in general, the challenge is going to be 2 grams of peanut protein. And 2 grams of peanut protein is going to be about 2 level teaspoons of peanut butter, or 2 level teaspoons of peanut flour. And you have to mix that into an appropriate food, of course. So peanut butter can actually be a choking hazard. So we never give peanut butter directly from a spoon. Peanut butter should not be given to children like lumps or chunks of peanut butter until they're about 4 years of age. So we would recommend either you dilute it with water or with breast milk, about 50% breast milk, 50% water, or 50% breast milk, 50% peanut butter. And you thin it out and you loosen it, and it can be fed just like that, or you can mix it into a puree. And the peanut powder or peanut flour can be mixed right into a puree as well. And then the first taste should just be a little teeny tiny taste. So offer a small taste on the tip of a spoon. You wait 10 minutes, and if there's no allergic reaction after the small taste, you can slowly give the remainder at the infant's usual eating pace.
Great. That's awesome. I know that people will love having that real practical approach. And I will include in the show note link the portal URL for the NIAID website, as well as I think you said NIH had some examples, guidelines. I'll include those in the show notes for people too.
Yeah, very nice recipes for including it. So once you introduce it at home, this is the other aspect. So when I said introduce early and feed regularly, the recommendations are to feed this 2 grams of peanut protein, which is, again, about 2 teaspoons of peanut butter, 3 times a week.
Okay. Good. Good to know. Good to know. So that is a real change. That you're right. It has turned the recommendations from the past on their head. I remember with my first 3 daughters, we didn't do peanut butter until after age 4. Because I believe in the late 90s, when I first started having my children, the recommendation was to wait until they were age 4, and then they sort of subsequently dropped the recommendation. So I remember my second one feeding her cream cheese and jelly sandwiches, wanting so desperately to do peanut butter, but holding off. And that was not easy. It was not easy to hold off. I suspect that there are families out there that weren't aware of the guidelines and just introduced peanut butter when they introduced peanut butter.
Right, and who knows, they were probably better off for it.
Yes, I'm wondering. So you also mentioned earlier in the show the process of treating food allergies. And I'm assuming you meant outside of, epinephrine and any kind of... Yeah. So what are you talking about when you say treatment of food allergies?
So, epinephrine is obviously treatment of a food allergic reaction, but, there are now many clinical trials looking at immunotherapy to food allergens. So immunotherapy is, just like think about, people who have allergies to pollens and they get allergy shots. So immunotherapy to food allergens, we're not doing a lot of shots, but what we're doing is oral immunotherapy, so giving very minute, tiny doses of the food protein and gradually increasing it and trying to desensitize the patient along the way. We can do that through the oral route. We can do it through the skin. So there are patches. So there's a peanut patch and there's a milk patch, and you put it on the skin, and that also they wear the patch, and that also is a form of desensitization. What else? Many years ago when I first started, we just started doing the baked milk and the baked egg trials, and introducing baked milk into the diet of a child who is allergic to fresh, unheated milk, if they can tolerate it, actually is a form of immunotherapy. It actually, it's nice for them because they don't have to worry about those trace amounts of milk, but it also helps them to become tolerant to fresh milk more quickly.
Okay.
So that's another form of immunotherapy. So most of these at this point are in clinical trials. I would say that, we're moving more toward clinical practice, especially for the children who have been on these trials. So say you have a child who has wheat allergy and they have been in a clinical trial to desensitize to wheat, and they were at the beginning of the trial very sensitive, and 3 milligrams of wheat protein caused anaphylaxis. But now they can have 2 grams, so that's like 2,000 milligrams of wheat protein without having a reaction, and they have it every day. What do you do when the trial ends?
Right,
because during the trial, they get that wheat protein from the pharmacist. So it's sent to them, and they have it every day. But now the trial has ended. Do we tell them to go back and strictly avoid? So what we've been doing is transitioning those children onto food products. So that's actually been a fun part of my job, because I've had to create all these protocols for different dosing of every food. So milk, egg, wheat, soy, peanuts, all the tree nuts, and doing it from real food. So I don't want this child to have to eat the same food every single day. So I provide a variety of foods that will give him 2 grams of wheat protein, so that every day he can have something so that he gets his dose.
Wow, that's awesome. Now, how do you calculate that? Like I'm now my dietitian nerdy brain is taking over. Calculating
that is challenging, and you really need a dietitian to do that work. So if you look at a food product, the first thing I'm looking at is are the proteins in this product coming only from wheat, or are they coming from milk ingredients, or an egg ingredient? So I have to look at products that are only mostly wheat-based, like a pasta or a cracker. What are some of the other things? Some of the breads we use are fine.
Cereal.
Yeah, but and some cereals, yeah. But, I certainly don't want to use a cracker that has cheese. So I don't want to use like a goldfish cracker, because when I'm looking at the wheat protein content, I can't tell whether, or I'm looking at the protein content of the product, I can't tell what's wheat protein and what's milk protein.
Right.
So I won't know whether I'm giving him the proper dose. And the other thing is, you can't always just read the product label, because we round in the product label. So for a child who's on 2 grams, it might not be as important than a child who's on 500 milligrams.
Right.
Because we can round up 500 milligrams. So there is, I'm just trying to think of the name of it, the National there's a National Nutrition Database.
Oh yeah, the USDA nutrient database.
Yeah. And so I use that to calculate to really milligrams.
Good.
So that we really know what the child is getting. Yeah.
Yes, yeah. I consider that the gold standard of any kind of food nutrient analysis process that I use as well. And so for any dietitians out there listening, that's the gold standard. Don't use some of these, Fitbit apps on the website to analyze the nutrients in food. You want to go to the real standards. So, all right, that's really great. Marion, this has been such a lot of great, useful information. I want to just drill it down. If you had to think about the 2 or 3 most important things you want listeners to know about food allergies, about preventing food allergies or treating food allergies, what would you say those important things would be?
Well, I think that, we have to be aware that guidelines are changing. Guidelines are always changing. And physicians, when I think about pediatricians and what they have to keep abreast of, their guidelines are changing for food allergies, but they're also changing for, diabetes and for weight control and for vaccination. They change for everything, and they have to keep on top of that. So I think if you have a child with food allergy, you should be seen by an allergist who might be on top of the allergy guidelines, the new guidelines that are coming out, so that you really have the most up-to-date information. Unfortunately, right now, we're still focusing on avoidance to keep people safe, but I'm very hopeful for the future. I hope that we're going to see less food allergy based on the new early introduction guidelines. Right now, we're just introducing peanut, but, there's a lot of interest and a lot of research going on now for early introduction of milk and early introduction of eggs, so we might be seeing those guidelines change too soon. So I'm also hopeful that food avoidance will not be the only treatment for food allergies, and that we might be able to help people to become desensitized and maybe even tolerant to foods moving forward. So that's another one of my hopes. And even for those who may not, become tolerant, meaning that they're no longer allergic, I'd like to see that they're desensitized to the point that parents don't have to worry about those trace amounts of allergen causing a severe reaction. And that would be another benefit of immunotherapy. So there's a lot going on. This field is always changing, which is exciting, but I think for families, it's exciting too. It's changing for the better.
It sure is. It is. There is a lot of stuff happening in food allergies, but even just in childhood nutrition in general. It's really just, you got to really be on top of stuff. So what are you working on now, Marion? Or anything you want listeners to know about, any special projects that you hold near and dear to your heart, or anything of that nature?
From the perspective of IgE-mediated allergies, we are working on, studies looking at early introduction of milk and eggs. So those will be really interesting. There have been some already, but we're looking at larger studies. I think, for me, I've been working a lot with families with non-IgE-mediated allergies, and there might be some listeners who have children with eosinophilic esophagitis or EOE or food protein-induced enterocolitis syndrome or FPIES. And we've actually just published the very first international guidelines for the diagnosis and management of FPIES, and that's really exciting. Because FPIES has been really a challenge to manage, and families who have children with FPIES really struggle with getting good advice. So we're really proud of that work. That's come through the American Academy of Allergy, Asthma, and Immunology. So that's a nice one. In terms of eosinophilic esophagitis, we're involved in a lot of large clinical trials for EOE, and we've just published, again, like dietary therapy and nutrition management of eosinophilic esophagitis. And this is actually, both of these documents are actually open access. So anybody can access them. You don't need to have a medical library. And the EOE paper is nice for dietitians because there are a lot of great handouts. And that would really help you to manage patients on like 6 food elimination diets or even just, one food elimination. I think it's going to be very helpful.
That's good to know. I'll search for those links and include those in the show notes as well. Yeah, it's interesting. I work with a lot of children who have ARFID or extreme picky eating, and I've had a few of them have an underlying EOE case. A case of eosinophilic esophagitis. It's very, the ramifications can extend beyond just the allergy, obviously.
Oh, absolutely. I mean, that's why actually my background has served me so well in the food allergy world, because we see a lot of children with feeding problems. And we've just finished a study looking at children with FPIES, and we're seeing feeding problems in that population too, more so than in children with just IgE, not just, but IgE-mediated allergies.
Really? That's interesting. What about, and just out of my own curiosity as a dietitian, because I do see some children with food allergies, not many, but I do see some, and the whole growth and nutrient deficiency issue amongst children with multiple food allergies, I see that almost always coming up.
Yeah, so again, I feel like my entire career, I've seen the same kind of children who are not growing well. And it's sort of the opposite problem that we have in this country, where children are, unfortunately, we're seeing more and more overweight and obesity, but the kids that I see, for the most part, are, shorter in stature and really not eating as well. So I forget what your question was.
I just the whole association of multiple food allergies with growth failure and nutrient deficiencies.
Yeah. So we're not sure exactly what the cause is, and whether there may be some underlying inflammation that might be causing it. We certainly see that in a subset of patients that their nutritional intake is similar to other children, but they're still not growing well. So there may be some underlying inflammation that we might want to address. But certainly, transitioning children off of breast milk or formula too early, especially those with cow's milk allergy, is a real problem. These kids cannot go to almond milk or rice milk at a year of age. And the World Allergy Organization recommends maintaining their substitute formula or breast milk until 2 years of age for children with cow's milk allergy. And that's very different from our general pediatric guidelines. So we see a lot of kids between 1 and 2 years of age that have been recommended because the pediatrician doesn't know that there are specific guidelines for children with cow's milk allergy. So they transition them to something that's just really a poor nutritional quality. When you are looking for substitutes, they have to be nutritionally dense. And especially at that population, that age group, it has to have enough protein and it has to have enough fat. And so when you make substitutes, you can't just eliminate foods, as you know. You have to actually offer foods that have adequate nutritional value as a substitute. So that's an area that as dietitians we can correct. We can actually optimize their nutritional intake and really help them grow more appropriately.
Yeah, I generally say if your child has more than one food allergen or food allergy, you should be seeing a dietitian, particularly during that important phase of childhood when there's all this growth and development happening. But I don't think that message really gets out to the public very much on a regular basis, because I just see so many families who have more than one food allergy, and that whole nutritional guidance piece has been missing, and you can see it. You can see it in their growth, and you can see it in the quality of their diet.
Well, I can tell you that on all the food allergy guidelines, so we have from the NIAID, we have just food allergy guidelines, or overall food allergy guidelines. We have the DRACHMA guidelines for cow's milk allergy. We have EOE guidelines now. We have FPIES guidelines. Every single one of them says that patients, children especially, with food allergies should be seen by a dietitian because of the increased risk for inadequate nutrient intake and poor growth. And, multiple food allergies are a problem, but even children with just cow's milk allergy, I think they could really use guidance because, if you think about young children who typically have a couple of cups of milk a day, they eat cheese, they eat full-fat yogurts, and if you eliminate all those foods, and then you eliminate all those sort of processed foods that have a milk ingredient, these kids end up on a whole diet, which is very healthy. They're eating fresh fruits and vegetables and, whole grains that don't have other ingredients, but parents don't recognize that the diet might be low in fat and protein and other nutrients like calcium and vitamin D. And so we have to really even see those children with just cow's milk allergy.
Mm-hmm. Well said. Woohoo to the dietitians out there. Lots of work for you if you're listening.
That's
all right. So, Marion, where can the listeners find you? I am going to include all the links to the wonderful position papers that you mentioned. But in terms of finding you, like getting our hands on you, I know where to find you, but where does the rest of the world, how can they find you?
So I'm the Director of Nutrition Services at the Jaffe Food Allergy Institute. So we're part of the Division of Pediatric Allergy Immunology at the Icahn School of Medicine at Mount Sinai. I'm located in Manhattan, 5 East 98th Street. And in order to see me or to see any of our wonderful, excellent allergists, the number is 212-241-5548.
Awesome. So you're going to have a lot of people knocking on your door.
I welcome them all.
Oh, that's wonderful. Marion, thank you so much for spending some time with me today and sharing your expertise on the Nourished Child podcast. I know that everybody is just going to be loving this episode. I do. I've loved this whole time. So thank you again.
Oh, thanks so much, Jill. Thanks for having me.
You are welcome. Well, there you have it, everyone. What a show. Marion is so knowledgeable, and she just gave so much great advice and practical application. So I hope each and every one of you got something out of the show. I know I did, and I am so happy to be able to have brought to you somebody who is on the cutting edge of food allergies and nutrition. So I'm super grateful she could squeeze my podcast into her very busy schedule. And how gracious of her to offer herself to all of you. So I'm not really sure she knows what she's in for, but let's make sure you have that address and her contact information should you have a child with food allergies that you'd like to have evaluated by her or her group. She is located in Manhattan, so obviously you'll have to be in that area. But if you're not in that area, it always is a good idea to have your child evaluated, assessed, or just have a quick check-in with a board-certified pediatric food allergist and a registered dietitian who specializes or who has expertise in food allergies. It's always a good idea, even if it's just an annual checkup to make sure everything's A-OK. I would really love for you to help the Nourished Child podcast grow. If you do nothing else, please consider writing a review on iTunes. If you find this show adds to your knowledge about childhood nutrition, brings you a better sense of feeding your child, or inspires you to be a better parent, consider sharing the love. Writing a review is the single most impactful thing you can do to bring this show in front of other parents. Of course, you can subscribe to the show on iTunes, on Android, Stitcher Radio, Google Play Music, TuneIn, and now you can download an app called Parents on Demand. There's an app that aggregates a whole bunch of different parenting podcasts, and The Nourished Child is one of the podcasts in that aggregate. So if you download that free app, again, it's called Parents on Demand, that will appear on your smartphone, and you will be able to listen and get real-time updates of all podcasts related to parents and parenting. If you're on Facebook, why don't you stop on by the Nourished Child page and join me there? Not only do I share the podcast, but I curate interesting articles, scientific updates, and my own blog posts. And hey, I've even been trying my hand at video. So come on over and check it out. It's www.facebook.com/The Nourished Child. I am so glad you joined me today and very grateful. I hope you take a quick moment out of your day to give the child in your life, big or small, a loving squeeze. Until next time.
Thanks for listening to the Nourished Child podcast, where the #1 goal is to help you grow a nourished child inside and out.